Dr. Michelle at Valley Veterinary Clinic, and today I wanted to talk with you guys about something that's very, very important, and that is canine parvo. Unfortunately, it is parvo season. Even though we can see it all year round, we do see the highest cases during the few months in the fall. What I want to go over with you guys today is a little bit about what parvo is, and then a couple ways that you can go about preventing it in your household. So parvo is caused by canine parvovirus, and it's a virus that basically goes into the GI tract and kind of sloughs off the intestinal lining. What that does is, as deadly as the virus is itself, is it actually allows for secondary invaders, so we get a lot of secondary bacterial infections from this, and that can actually result in a patient passing away from parvo. When parvo strikes, usually what we initially see is any form of lethargy to lethargy, vomiting and diarrhea to vomiting on its own. And so if you have a young animal that has not been fully vaccinated showing any of those signs, then we need to see that pet right away. Parvo is extremely contagious and it can be life-threatening. The good thing is that there are several ways that we can kind of prevent parvo. And so I wanted to go over 3 different ways with you guys today that can help keep your pet healthy and safe. The first thing is vaccinate, vaccinate, vaccinate. So parvo is, being that it's a virus, is something that we can vaccinate for. And the good thing is the vaccines work very efficiently and very effectively. The bad thing is it takes more than one vaccine to make a pet fully vaccinated. And the rule of thumb is basically when a puppy reaches 16 weeks of age, we want to vaccinate that pet initially for parvo, and then about every 3 weeks after that until they're about 4 months old. At any time during this interval, they are susceptible to parvo, even if they've had a vaccine on board, because a lot of the maternal antibodies from the mom will destroy a lot of that vaccine. So we have to keep boosting them, much like with children, to make sure that they get to a healthy, normal level. And make sure when you do vaccinate, you want to go to a veterinarian to have this done. There's certain ways that we have to keep the vaccine stored, and then we have to give it properly in order for it to be effective. And I have unfortunately had cases where people have fully vaccinated their puppies at home, and at 4 months have still had cases of parvo affecting their dogs. The next thing that you can do is you want to make sure that the exposure is limited for your pet. Now, I have had some people that are keeping their pets strictly inside. They're not letting them go outside for walks, things of the sort. I think that's a little bit extreme. And so what I would recommend is just make sure you're not taking your puppy to anywhere like the lake or to a doggy like a playground, anywhere that you're around dogs that you don't know that may or may not be vaccinated. And then lastly, you want to make sure that your pet, that for you are not bringing anything home on either your shoes or your clothing, or your friends are not coming in from somewhere where there has been a case of parvo within up to a year. So parvo can survive in the environment for an extended period of time, and especially outside in the backyard for over a year. And so it may not be something that you necessarily think about, that you have a friend come over and hang out, but they may have had a dog that recently was exposed to parvo a few weeks ago, and potentially that could be putting your patient at risk. So hopefully these tips will help you guys in keeping your pets nice and safe. I want to reiterate once again, if you do have a puppy that's under 4 months old that is showing any signs of lethargy, vomiting, or diarrhea, to give us a call right away. There are treatments that we can do for parvo. We do have a very good success rate, but it is extremely serious and definitely needs to be addressed right away. And then if you have any other questions, please feel free to give us a call. Otherwise, I'll see you at the clinic.